As a general rule, reporting quality measures directly from your EHR or through a measure group should be considered first. If these easier approaches are not available or applicable, you will need to report individual measures. To earn the PQRS bonus payment for 2014, you must report 9 individual measures. CMS has assigned each measure into one of 6 domains, and you must select the 9 measures so that at least one is in each of 3 of those domains. To avoid the penalty, you'll need to report 3 individual measures. If you have 10 or more providers in your group, you'll also avoid the 2% value-based modifier penalty if you report 3 measures as a group or 3 measures individually for at least half of the providers in your practice. Each selected measure must be reported on 50% of applicable Medicare fee-for-service patients who were seen during the calendar year, and the performance rate on each measure must be greater than 0%. If there are not 3 measures that apply to your specialty or patient population, you may report on only those that do apply. However, CMS will do a statistical review of claims data to determine whether you could have reported additional measures. To better understand how CMS will calculate whether you've achieved the 50% reporting rate and the 0% and the greater than 0% performance rate, take a look again at video number 2, PQRS Basics. Your first step is to identify the measures that you want to report on. There are 284 measures, and you'll need to download some files to explore the details. Go to this URL and click on Measure Codes. On the next screen, scroll down. The Implementation Guide link will allow you to open and save a zipped file that has 2 files. One of these is labeled Measure List, and this is a great file that shows each of the 284 measures, including the domains, and on the right side of the chart whether that measure can be reported on claims or registry or both. The second link that I've labeled Detailed Specifications will open another zipped file that looks like this. Open the largest file shown, which is a 613-page PDF file. You can use the smaller measure list or the table of contents in this document to identify measures you are interested in, and then find the 2 to 4-page detailed specification for each. These will provide the frequency, the denominator definition, and the quality codes that must be reported. So which should you choose? It can be overwhelming because there are so many of them. We suggest that you check your association's website and do a search for the term PQRS. Many associations have a list of measures that are most appropriate for their specialty. You can also just review the list of measures and look up the details for any ones that look like they would be applicable to your patient population. Once you've identified some options, think about how big the qualifying population is and how easy it will be to identify them. Remember, they will all be Medicare fee-for-service patients covered by Part A and Part B, not Medicare Advantage patients. You might be tempted to select measures that only apply to a small subset of your patient population. This can result in less data entry, but you'll need to be vigilant to be sure that you identify them all so that you reach the 50% reporting requirement. Another strategy is to choose measures that apply to all Medicare patients. More data entry, but easier to identify them. Here are some measures that you might start with. These are applicable to most specialties and providers and generally would apply to all Medicare patients that you see in the office setting. Be sure to carefully read the measure specification document for any measure that you're considering reporting. One mechanism to report individual measures is to include the applicable quality codes on the same claim as the qualifying service. If the denominator definition is female patients over age 50 with a diagnosis of X and a CPT code in a specified list, then every time you bill a service that matches this definition on a claim that goes to your Medicare Part B intermediary, the claim should also have a quality code. Since most claims are now filed electronically, it's important to understand how your practice management system bundles and separates transmissions in order to ensure that the 2 codes are processed as a single claim. In this example, data entry for the clinic's PM system is shown with the top charge reflecting the qualifying CPT code, in this case 99214, and the bottom charge showing the quality code 1036F. In this system, you must submit the quality code in the same batch with the same patient identifier, the same performing provider, attending provider, and referring provider, as well as the exact same diagnosis codes in the exact same order. Failure to do this will result in the quality code being separated from the qualifying service and not being counted toward your 50% reporting rate. There are some important limitations related to claims-based reporting that you should consider. First, this method of reporting cannot be used for the group. It is only available for individual providers. Second, be sure you've selected measures that can be reported by claims. Third, realize it's almost impossible to know how you're doing throughout the year and whether you've achieved the 50% reporting rate. Best practice would be to put in place comprehensive and consistent processes that are followed by all providers or nurses over the course of the year for all applicable patients. Staff and providers will need to understand the new processes, what patients they apply to, and what the consequences of missing too many patients will be. They'll need regular reminders over the course of the year. Finally, in order to achieve the 50% reporting rate, it will be critical to begin consistent reporting no later than June 1st, and preferably by the middle of April. If you started in July and had equal numbers of patients in the first and second 6 months, you would need to report on 100% of applicable patients. No opportunity for mistakes. The earlier you can start, the more room you have for some of those inevitable errors. A second mechanism that can be used to report individual measures is via an approved registry software program. You can access a list of 2014 approved registries on the CMS website by June of 2014. Fees are usually $300 to $500 per provider. Registry data is normally collected during January 2015 and reflects all Medicare Part B patients seen during calendar year 2014. Registries provide an array of tools that allow you to capture, enter, or upload data on the selected quality measures for your Medicare patients. Here are a few suggestions of registry programs that you may want to explore. If you report via a registry, you can choose whether to report a group or separately for each provider. Remember that if you report as a group, you'll need to register and identify your reporting approach as individual measures through registry by September 30th. Select the registry program as soon as possible with an eye toward the amount of work that will be required to enter and upload the data. Check with your EHR vendor. Some have a registry module or a partnership with a registry that will allow you to export EHR reports directly to the registry for PQRS submission. See if you can find 3 measures that apply to the same patient population. Consider whether to collect the data real-time by completing a form, template, or flow sheet when the patient is being seen, or whether you prefer to do a chart review to record data retrospectively. Either way, it will be useful to have consistent processes and tools that are used. There are 2 remaining videos in our PQRS series. Video number 7 allows you to see how some practices have selected and implemented their PQRS programs. For practices with 2 or more providers who decide to report as a group rather than as individual providers, you'll want to take a look at video number 8, which provides some detailed instructions.